Now let's move to our section 4, and in this section we will discuss 3 other conditions, which are the Reinke's edema, Pachydermia laryngis, and also atrophic laryngitis. So these 3 conditions we will discuss one by one in our section 4. So first, the Reinke's edema. It's a bilateral, so both sides are affected, symmetrically affected, not asymmetrically. Swelling of whole of membranous part of the vocal cord, most often seen in middle-aged men and women. This is due to edema of subepithelial space, and known as this space, subepithelial space, is known as the Reinke space of vocal cord. So that's why the swelling or edema of this in this space is known as the Reinke's edema. So it's a symmetrical swelling of the subepithelial space known as the Reinke space of vocal cords. The clinical features include the hoarseness of the voice, low-pitched and rough voice, fusiform swelling in vocal cords, and hyperemic and hypertrophic ventricular bands. Treatment of Reinke's edema, we have decortication of vocal cords, removal of strips of epithelium, voice rest, speech therapy. So if you see, this is the trying to remove the strip of epithelium, voice rest and speech therapy. Then the other condition is Pachydermia laryngis. It is a form of chronic hypertrophic laryngitis affecting posterior part of larynx in region of interarytenoid and posterior part of the vocal cords. So pachydermia, patch is the portion, or patches, dermia is the skin. So it's the form of chronic hypertrophic. It affects mainly the posterior part of the larynx in interarytenoid. Inter means between the arytenoid folds and posterior part of the vocal cords. That's the appearance of Pachydermia laryngis. Clinical features: hoarseness or husky voice, irritation in the throat, granulation tissue in interarytenoid region, contact ulcers, excessive forceful talking, and gastroesophageal reflux disease. So all these are the features associated with Pachydermia laryngis. Treatment of this condition is removal of granulation tissue, control of the acid reflux, speech therapy, voice rest. All these are important treatments for the condition. Then the third condition in this section is the atrophic laryngitis. Atrophy is opposite to hypertrophy. Hypertrophy is their excessive proliferation. In atrophy, there is atrophic, or this is decrease in size or less proliferation. It is characterized by atrophy of laryngeal mucosa and crust formation. Condition is seen in women and associated with atrophic rhinitis and pharyngitis. We already talked about in one of our previous lectures atrophic rhinitis, which is the atrophic inflammation of the nasal mucosa and the pharynx. So this is also associated with those conditions whenever atrophic pharyngitis and atrophic rhinitis is present. Symptoms is hoarseness of the voice, dry irritating cough, Dyspnea, difficulty in breathing, and obstructing crusts are also present in atrophic laryngitis. Examination and treatment. On examination, usually there is foul-smelling crusts are present, mucosal excoriation and bleeding, and there is also crusting in the trachea are present. Treatment is humidification, laryngeal sprays, and expectorants like ammonium chloride or iodide. So, atrophic laryngitis is associated with atrophic pharyngitis and atrophic rhinitis, and it can also cause obstruction and then cause hoarseness of the voice. On examination, there is atrophic mucosa, and that atrophic mucosa usually have foul-smelling crusts present. And there is also crust present in the trachea that can lead to the airway obstruction. And the treatment is humidification, laryngeal spray, and the expectorants. So that was all about section 4. Thank you for watching sqadia.com.